Welcome to this speaking lesson on opening a role play. In this lesson, we're just going to look at a couple of different ways of opening a role play. Remember in the speaking exam that you're in control of the consultation and you'll begin the role play. So the interlocutor will be waiting for you to start. So it's important you use the 3 minutes preparation time to think about how you're going to start the role play. Remember, there's no one way to start the role play, but it all depends on the situation, it depends on your patient. Okay, so let's start. So, this is the third lesson on the speaking course. Hopefully, you watched the first 2 lessons, the overview lesson and a patient centered approach with Beth. You then have 3 more video lessons after this, and then there are 2 more lessons on language. After that, you're good to go with the practice tests. So we've got a couple of tasks here. The first task, you need to identify the objective. So have a read of these sentences and decide what is the speaker doing. So if you just want to pause this video and then just read the sentences and try and identify what the speaker is doing. Okay, so how did you get on with that? That wasn't too difficult. You can see in all of these sentences, you can see the patient's name, and that's all the speaker was doing, the nurse or the doctor. They were just getting the patient's name. But they were also checking to see what the patient preferred to be called. So you might have a patient called Mr. Smith, but they might prefer to be called Tom. So it's just nice to ask a patient what they prefer to be called. Okay, number 2, it's the same thing. You just need to read the sentences and decide what is the speaker doing. Okay, so if you just want to pause the video. Okay, so you can see in all of these sentences, this time you can see the name of the nurse or the doctor. And that's all they're doing, they're just giving their name, they're just introducing themselves. Okay, and finally, the third objective, again, just pause the video, have a quick read and decide what is the objective, what is the speaker doing. Okay, a little bit more tricky, but the speaker here, basically, they're telling the patient what is going to happen. So they're telling the patient maybe the reason for the consultation or what is going to happen next and what they're going to do. It's a little bit like signposting. You're just telling the patient, it's just a polite thing to do. You're just telling the patient what is going to happen in this consultation. So in other words, you're setting the agenda. You're telling the patient what's going to happen. Okay, so just to quickly recap on the 3 stages of opening a consultation. Getting the patient's name and asking what they prefer to be called, giving your name, and setting the agenda. Okay, so these are 3 stages of opening a consultation, not 3 stages of opening a role play. I mean, you could use this to open a role play, but you must remember that every role play is different. But this is one way that you can open a role play. Okay, so let's have a quick look at this dialogue. Again, you're going to have to pause the video, quickly read the dialogue, and see whether the doctor meets the 3 objectives we've just looked at. Okay, so how did you get on? So straight away the doctor got the patient's name, and they checked as well what the patient wanted to be called. The patient was called Mr. Dickens, but he preferred to be called Tom. And then the doctor introduced themselves. And finally, they set the agenda. They told the patient what was going to happen. Okay, So these are the 3 stages of opening a consultation, which you can use to open a role play. But like I said, just be careful, because with some role plays, you won't be able to use these 3 stages. Every role play is different, and you've just got to be careful. Okay, so let's look at this task here. And I'm just going to ask you to again pause the video and just read the highlighted area. Don't worry about the tasks, but just read the highlighted area, the background information, and then decide how would you open this role play. Okay, so if you'd like to go ahead and pause the video, have a quick read and a quick think. Okay, so how did you get on with that? How would you open this role play? Well, in this role play, you couldn't use those 3 stages we've just looked at, because this was really important. It says on examination, so actually you've just examined the patient. So it wouldn't work if you just suddenly introduced yourself to the patient and if you said, "Hi, my name is Dr. Smith, what's your name please, how can I help you?" That doesn't work here, because the consultation has already started. So you really got to read the role play card carefully. The first task here was find out, and in this role play you can kind of get into the task very quickly. You really don't need that introduction. And that's what I mean when I say every role play is different. You've got to read the card very carefully. So how would you start this role play? Well, you can be more direct and kind of just get into the task. Okay, John, well, thanks for letting me examine you. Could you just tell me a little bit more about how you're feeling? Or, okay, John, would you mind just telling me about any other symptoms you have? Okay, so you can see in this task, because the consultation has already started, you can assume that you already know the patient's name and they know you, and you've done the whole introduction. We've got the patient's name here, John, and if you're not sure what name to use for the patient, you can ask the interlocutor. Remember, for those 3 minutes, you can ask the interlocutor any questions. And if you're already in the middle of a consultation and you need a name, you can just ask the interlocutor what you can call them. Okay, so same kind of thing. Just read the highlighted area, read the background information, don't worry about the tasks, and again, just decide how would you open this role play. So if you'd like to go ahead and please pause the video. You might note that here in the setting, you're in a general practice. The setting is always really important. It provides a useful context. And in a general practice, you can assume that a doctor or a nurse will generally know most of their patients, and the patients will know the doctor or the nurse. And it really implies that. It says your patient. It's kind of telling you that you do actually know this patient. And it was a recent diagnosis. So you're aware of what the problem is, and you've probably seen the patient recently. So once again, it wouldn't really work if you introduced yourself quite formally. If you said, "I'm Dr. Da-da-da, what's your name please, how can I help you?" That wouldn't make sense, because you know the patient and you know the problem as well. And the patient knows you. Here's an example how you might start. It says here, "Hi Mary, how have you been getting on?" So it's quite a nice informal way of starting a role play. It's always nice to kind of say hello, how are you doing, if you do know the patient. And then here the patient, the interlocutor, they do their task, and then you get straight into the task. That's good to hear. Have you been managing to take your medication? So again, you can see those 3 stages we looked at, they wouldn't work here, because You know the patient and the patient knows you. Okay, so just do a quick recap. The 3 stages we looked at: obtaining the patient's name and their preferred form of address, so what they prefer to be called, introducing yourself, and setting the agenda, telling the patient what is going to happen next. But do remember to approach each role play individually. Every role play is different, and you really got to read the task carefully. You can't use these 3 stages in every role play. So remember, there are different ways to open a role play, and you need to use those 3 minutes preparation time to plan how you're going to open the role play. Think whether you know the patient. Does the patient know you? Do you know what the main complaint is? And remember that you start the role play. You are in control of the consultation, and the interlocutor will be waiting for you to start the role play. They'll start the time and tell you when to go, but they'll be waiting for you to start. So make sure you do use those 3 minutes to plan how you are going to start the role play. Okay, I hope that was okay, and I hope that was of some use. Thanks for watching.